partnerships between public institutions, private payers, communities, and even leveraging social media, right?
Power of cross-sector collaboration is immense. When you think about this idea and concept of cross-collaboration, while it can be powerful, it can also be messy because each sector comes to the table with its own priorities, its own language, its own timelines, its own metrics for success. And so what I've learned is that effective partnerships require not just the alignment of goals, but also the alignment of values. You can't build a durable coalition if one party sees community input as optional, or if another is focused solely on short-term returns. So there is power in numbers. Many hands make light work.
Hey everyone, welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey, and I have another great interview with another great healthcare leader, Dr. Michael Forde. How are you today?
I'm doing well. Thank you for asking. How are you doing?
I'm doing wonderful on this Friday as we record. So if you don't know Dr. Michael Forde, he is a public health leader with 10 plus years of experience driving innovation, strategy, and education across public and private sectors. As the Director of Health Equity at Aetna Better Health of Maryland, he leads efforts to reduce disparities and improve access to care for the state's Medicaid populations. He holds a BS in Health Science from Southern Adventist University, an MSPH from Campbell University, and a Dr. PH from the George Washington University. Dr. Forde is a Black Health Connect 40 Under 40 honoree and a Gates Millennial Scholar, recognized for leadership, community impact, and professional excellence. Passionate about health equity, data-driven solutions, and sustainable impact, he works to build inclusive, community-centered systems that promote lasting change. Dr. Forde, this is a great background, and I know this is something that you're super passionate about. I mean, when you kind of think about what's happening right now in the state of healthcare, I think there was a 2023 CDC report that highlighted that nearly 1 in 3 adults with unmet social needs had worse health outcomes. How can Medicaid and managed care organizations address these disparities through strategic partnerships and community-based initiatives?
That's a great statistic that you brought up. And that statistic, if you think about it, it speaks volumes about the deep connection between social needs and the deep connection between health outcomes. When we, as healthcare professionals, talk about Medicaid populations, oftentimes we're referring to those who are facing complex challenges, limited income, unstable housing, food insecurity, a lack of transportation. There are much more. But these aren't just what I consider background factors, because they actually actively shape how we think of whether someone can access care, whether someone can follow their treatment plans, whether someone can have the ability to prioritize their health in the first place. So strategic partnerships really help with closing these gaps. This is through something that I would consider the need for authentic and deeply rooted community understanding. And that starts by moving beyond the traditional clinical models to recognize that community-based organizations, or if you hear me say CBOs, they have to be better positioned to reach people where they are. And that means not just reaching people where they are in the geographic sense, but also reaching people where they are in the cultural sense. So I've seen success with managed care organizations who intentionally fund, intentionally resource, intentionally co-design programs with community stakeholders in the sense that they don't just outsource or refer, but they work together to align goals across systems. For example, health plans, housing authorities, local food banks. Sometimes they operate in silos, but when they're all brought together, data that's shared with the sense of mutual accountability can drive measurable impact. So I would just say that the future of Medicaid innovation is all in the ecosystem, but not just the health programs or partnerships. They have to be grounded first, data sharing, long-term investment, and community infrastructure. Without those things, we will just continue to treat the symptoms of inequity without treating the underlying conditions first.
Mm-hmm. Well said. The outgrowth of that, right? I know there was some investment on capturing data, for patients, who are unhoused or need transportation needs. other those social determinants of health, right? And that was a step in the direction of potentially creating programs from a health plan standpoint that can meet these needs. This is a little bit off base of what we maybe discussed, but I'm just curious in this new maybe economic political environment, do you still see the impetus to kind of invest in these type of opportunities for the Medicaid population?
Definitely. This is the time. This is the time. The way I think of it is when the environment is shaky and when things don't have the best play in the whole geographic landscape, the national landscape, political landscape. This is the time when you want to invest. You want to really strengthen the communities that are vulnerable, strengthen the relationships that might be yearning for people to pour in resources or to pour in their time, to pour in their efforts. So when it comes to data and AI and all these advanced technologies that we can use to help build and strengthen the Medicaid population, but also other vulnerable populations, when things may not be going well across the land, it's a calling sign for people to pour in to the populations that need it the most.
Mm-hmm. And so do you feel that looking for additional sources to help make these programs sustainable, that may help, like you said, tie relationships with, maybe non-government partnerships, right, that can kind of help make these programs more sustainable? Is that something, a shift in a strategy standpoint, to kind of look at that as you guys navigate some new realities currently?
I would say that it is a shift, but it's not a shift that we were not prepared for, in the sense that public health and healthcare is truly focused on making sure that the lives of individuals, whether they be insurance members or patients in hospital systems or clinics, they have to have the best outcomes based on the most equitable care. And so what that means is that equitable strategies that make sure that everyone, no matter their color, their race, their background, their socioeconomic status, are cared for, are thought of in advance. A time like this, we are prepared for it because there are strategies that we've been building, and now we can implement them because of a time like this.
Mm-hmm. Oh, yeah, I love that. If you're a leader, being prepared for any moment, right, on both sides, right? A lot of business professionals, may say they were flat-footed with the tariffs and that affecting manufacturing, and even some of the things that we do with providing blood pressure cuffs to patients. But if you have a strategy, to your point, you can kind of maneuver both realities and be prepared for it. So that's the mark of a true leader, obviously, to kind of understand that. One of the things you brought up was just data informed, looking at data to understand how to better treat patients. You really are heavily focused on that, especially to help provide health equity strategies. How do you ensure that AI and data analytics help to close gaps in care rather than reinforce existing biases, right?
That's a great question. It's an important question too. So AI, as we know, very popular. Almost everybody uses it, from grandma and grandpa to the grandchildren. You have Chat GPT. You have a different GPTs out there that can really help access different data and pull it together to give you answers, whether it's forming a daily schedule for you or in healthcare, helping you understand different ways of reaching your patient population. It can be very powerful, but it can also replicate bias if we're not careful. And so data, in my opinion, and this is something that's more subjective, but it should be used to illuminate disparities, not just track the performance of members or patients. So what does that mean? That means that when you disaggregate the data, right, taking that large population of data aggregation and breaking it down into their subsets, when you disaggregate it by race, when you disaggregate it by ethnicity, when you disaggregate it by language, geography, even disability status, this is where we can identify where gaps are. But we also can apply a health equity lens to show how that data is collected. So the question now becomes, are we missing voices who are not included in the data? Are the tools that we're using to collect the data culturally appropriate? Are they culturally relevant? And the reason why we have to ask these questions upfront is because when AI is in the mix, sometimes we advocate for the human-centered review. Clinical teams working alongside algorithms should know that we should not rely on them blindly. So with technology, it's all about working along with empathy instead of replacing technology or empathy with technology.
Hmm. Yeah, I just did a video talking head about, can AI replace doctors? And I think that the thing you hit on is that's kind of going to be hard to do because that human element is so very important, right? To your point, AI, as we know, they do things called hallucinate, make up things. and so, and it sounds so, if you ever did a chat GPT, ask them a question, it sounds so sure, right? And so quick at the answer that you just assume is true, but it could be dead wrong unless you're a professional or an expert in that area. And so I think having a human being in the middle of that data set, can help prevent some of those biases, right? And also, I'm engineering by training, right? There's a saying, bad data in, bad data out. So biases do creep in based on the developers that developed the solution or the way the developers thought about the problem. Did you see some of the cases where facial recognition software, right, highlighted individuals with darker skin as being a bad actor in certain facets, right? Which is totally irresponsible, right? And so things like that, we have to kind of mitigate, to your point, to kind of ensure those biases don't creep in to the longer play. And I like how you mentioned using it to inform the data, right? Understanding like, where where the inputs are coming in and validating the inputs. A lot of like you said, a lot of people use the data to just track stuff, but then like, let's look at these inputs, right? Are there other inputs that can feed into the data set to make it more robust, right? And so I think that's so important when you kind of look at these health equity issues. And so I'm glad you brought that into the forefront. Artificial intelligence, we're going to kind of stay in this lane, is becoming more and more integrated healthcare delivery, right? More individuals. I mean, we use it all the time. You talk about patient outreach. We use it to do multilingual updates, right? We have patients that speak Hindi, Mandarin. It's so important to kind of make that quick change so patients have that connection. So when you kind of think of it from as a public health leader, how do you leverage this technology responsibly to advance health equity and improve patient outcomes overall?
So again, AI can be very powerful. And one of the things I will say is that with great power comes great responsibility, right? You heard that growing up.
Yeah. Well, I'm a Spider-Man guy, so yes, I know
You
that
know,
very well.
so we know that there is some responsibility that comes with the use of AI. And so responsible use of AI, especially in the field of healthcare, it has to have clarity of purpose. I have this running quote that I use at my job that, there's a difference between paperwork and purpose work. You can do anything on paper, but everything has to have a purpose. And so if we're using AI simply to cut costs, or if we're using AI to simply predict the risk without understanding understanding why certain populations are at risk in the first place, understanding why risk reinforcing disparities, sometimes we risk reinforcing disparities instead of addressing them. And so healthcare leaders need to approach AI not just as a technical solution, but as a mean of a social intervention. And so one of the most powerful uses of AI, identifying trends, identifying outliers that the human eye may not be able to see, may not be able to catch, similar to like detecting early signs of disease in hard to reach populations or recognizing patterns that may say, hey, there's some low engagement that could indicate access barriers. But again, these insights are only as good as the data that they're based off on. So if marginalized populations are underrepresented or misclassified in the data, AI could easily miss them entirely. Or, as we talked about before with some GPDs, it could sometimes produce misleading results. So leadership means slowing down the hype cycle just a little bit. AI is still important, but you have to ask yourself these hard questions. And I would start by saying, who is going to benefit from this technology? Who might be harmed by this technology? What are the unintended consequences of utilizing this technology? Are the people who are most affected by these decisions being consulted or talked to or thought of in a manner of inclusion before the tool goes live? And that last question sometimes is often overlooked because individuals and developers, they have these great ideas about pushing forth AI, but it's crucial to also include the individuals who will be using the tool, including their thoughts, including their opinions. And that's what you call community engagement. That's why it should be baked into the design phase, not just after something has been implemented. So overall, I would say AI, it has its role, it has real potential to advance equity, to advance healthcare. But in my opinion, again, it's only when AI is paired with policy reform, with equity centered governance, with deep listening to communities, with community engagement, when all those things are included, that's when I believe AI will be the most powerful. Because at the end of the day, it's not about replacing humans with machines. It's about enhancing decision making in ways that are not just good, but they're excellent and they're inclusive and they're grounded in every context of AI.
Mhm. There's a lot to unpack there when you kind of talk about it. There was a recent Harvard Business Review article that did a look at how people are using, individuals are using AI now. Last year, they did this study and they taught ones like brainstorming, helping with your job. Do you know what the number one use of AI was this year, based on like analysis from social media and all that?
I would have to say I'm not as aware as I should be. So, but
No
please
worries. Yeah,
tell.
it was shocking to me. A lot of people are using it for therapy and
Oh,
companionship. The number one, followed second was how to find purpose.
wow,
So
wow,
individuals are, and this is, based on, social media research. The researchers just said, hey, this is not, verified research, but it's observational and getting a bunch of use cases about how people are using it today. And so I did an informal poll with my 20 something, 24-year-old niece. I had a friend of mine who's in his 30s. I said, hey, are you using uh, artificial intelligence, ChatGPT, or any of the LLMs or large language models for therapy and ask questions about it? They said, "Oh yeah." I was shocked, and so to your
wow,
point, it's kind of interesting how the adoption is changing. An awareness for patients, right, to kind of seek out these models to kind of help with certain things, and maybe that's as an indication of our healthcare system, indictment, if you will. But I just thought that was kind of fascinating when you kind of talk about like, involving community, because you're right, healthcare is unique. It's not like any other industry. Decisions you make can hurt people and in some cases cause people, you know, to get seriously harmed. And so that's why we have things like HIPAA in place to protect data. There's protections, people should not be putting their medical records inside ChatGPT and do analysis of that, because
right,
it's taking that data and now more importantly, it's giving you inaccurate information. So I'll be curious to see how do you balance that need by the populace to get faster, and access is a problem, as we know, with healthcare, professionals. So I'm
right,
curious to see how you balance that need for healthcare now versus, the protection that's needed for healthcare. And, that may be an ongoing kind of conversation as we see this evolve over time. But, one of the things I did want to bring up was your unique cross sector background. I think you're perfectly positioned to kind of approach this, right? How do you kind of think about that? Building these partnerships between public institutions, private payers, communities, and even leveraging social media, right, to kind of build all this together in some kind of
right,
unique mixture to communicate and getting people on board on a path forward.
right, right. I would say, the power of cross sector collaboration is immense. It's immense. Um, my background in healthcare has led me to some amazing roles. One of them currently being the director of health equity for Aetna in Maryland. And I would say the number one thing that has helped me understand cross sector collaboration is with relationship building, which I'll talk about in a second. But, when you think about this idea and concept of cross collaboration, um, While it can be powerful, it can also be messy because each sector comes to the table with its own priorities, its own language, its own timelines, its own metrics for success. And so what I've learned is that effective partnerships require not just the alignment of goals, but also the alignment of values. You can't build a durable coalition if one party sees community input as optional, or if another is focused solely on short-term returns. So again, relationship building, why that's important. You mentioned social media. I have a LinkedIn. I've been building that LinkedIn for years. And one of the things that I love to do is connect with like-minded people in the space of healthcare, in the space of public health, because I know that, you know, there is power in numbers. There is power in numbers. They always say, many hands make light work. So when you think about relationship building, before the contract, before the project, before the metrics, that means you have to take the time to understanding what each stakeholder actually needs and understanding what each stakeholder fears. For example, right, public health departments, they may worry that they will lose trust um, if they have a partner with certain private entities, or community leaders may be skeptical of certain data collection or data collection techniques unless they know exactly how it will be used. So private payers, they may face pressure to show ROI quickly. So when you understand these tensions upfront from the beginning, it creates a safe space for more honest collaboration. And then transparency is also very critical. Transparency is also very critical because everyone needs to know what is being measured, what success looks like, and how feedback loops will be built into the process. So, even more importantly, communities need to be more than just quote unquote represented, right? So, they should co lead. What that means is compensating community advisors or sharing power, having them share power in decision making, and being flexible enough to adapt their programs based on local realities. So at the end of the day, partnership, I can go on and talk about it and the importance of it, and how you can utilize different um, techniques and strategies to implement partnership to the nth degree. But it's a long game. It's never a short game. It should never be a short game. It should always be a long game, because that long game shows, hey, I'm about trust. I'm all about accountability, and I'm all about a shared willingness to stay at the table, even when things do get tough.
Hmm. Yeah, I love that, and that's definitely on the path to building sustainable solutions. For the problems that we face. I'd be curious, what sort of problems currently is your role in this space, and as a health leader in the equity, but just thinking about health plans. What problems keep you up at night that you're like, hey, we can solve this. This will help us, on the path to the future.
I think right now, and it's fair to say this, that the climate of the nation when it comes to public health and healthcare is shaky on some fronts of equity. I think that's a fair statement. Also think it's a fair statement to say that different states have different interpretations of what my previous statement. But as for the state of Maryland, we are very progressive to making sure that equity is in play for all patients and all members through different models and through different strategies. So, what keeps me up at night um, is just making sure that I have the capacity as a leader to meet those strategies and to meet the necessary steps to make sure that the health outcomes of my members in the state are met and exceeded. The times are a bit different, but I have hope because I don't just work, as I said, with my body of colleagues. I collaborate, cross sector collaboration. We just talked about that. And I talk closely to colleagues of many sectors, and also um, people from all kinds of backgrounds, because I really believe I can learn from those of different walks of life, and it all helps me be a better strategist at the end of the day.
Part of those partnerships, is that potentially working with the NBA? And saw some of the pictures. If you haven't checked out Dr. Ford's Instagram account, Chris Paul, great professional basketball player out there. You know, what does that look like working in that space, or kind of communicate with them? Is that something
Right.
that can help educate and get people excited about healthcare from your standpoint? Having those connections.
Definitely. I feel like there's a role in health education for not just myself as a healthcare leader, but for many individuals as healthcare leaders. And my goal, right, is to ensure that I'm not just someone who can spread that joy in my job and in my setting of work, but in extracurricular activities. And I love meeting individuals who are working in finance or working in sports or working in different facets of law or business, and discussing with them different ways for cross collaboration. You hear it again, cross sector collaboration, uh, and really understanding why they do what they do and how that makes a difference in what I do and how that relates. Because at the end of the day, we are all different people from all different backgrounds. But there is always some joy in collaboration. There's always some joy in working together and joy coming together and understanding that while we might be of different backgrounds, different walks, different journeys, there's always something I can learn from you. And there's always something you can learn from me that can allow us to be better individuals outside of the job force and inside of the job force as well.
Oh, well said. Well said. Well, Dr. Forde, this has been so informative. Really enjoyed your perspective. Where can people follow you at and get more wisdom and thoughts on how to move forward in this interesting space we're in healthcare?
Definitely. My Instagram is Michael H. Forde. That's spelled MichaelHForde. And connect with me on LinkedIn. I love connecting with people on LinkedIn. And my LinkedIn is LinkedIn.com. I think you would do the forward slash, but you can find me at Michael H. Forde on LinkedIn as well.
That's wonderful. That's wonderful. So, everyone, I hope you enjoyed this powerful conversation with a leader in the healthcare space. Really talked about how you solve those difficult problems with cross sector background, but more importantly, cross promotional, building partnerships with different teams and building that into something that you can go after new opportunities, and really embracing technology to kind of do the hard things, but looking at it how it can help you solve problems that people aren't even thinking about by adding to the data sets you already have existent. So this is a very informative one for all the leaders out there. Hope you enjoyed it. Dr. Forde, thank you again for your time. Really can't thank you enough for that. And everyone, hope you continue to follow. If you like what we're talking about here, please put some comments in the chat window. Follow us for more information with these powerful impact stories. But definitely, we all want to learn together as we enter the new healthcare normal. Thank you. Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left and you'll get more content to understand how to best grow your practice.